So this template that I'm suggesting we look at today is called the SBAR template. And, originally it was developed in by the US Navy, and it made its way into healthcare in the 90s. And actually it's recognized by the Joint Commission as being the best practice for effective communication among healthcare workers and caregivers. I know this is a documentation class, but I do want to point out this organizing your thoughts in this way is an excellent way to concisely communicate verbally or even on the phone when you're leaving messages with the physician's office. So the first piece of this documentation template, the SBAR template, is the situation. That's what the S stands for. And really there, what we're asking for you to put is a simple sentence or two about what your therapy session is going to be focused on. For the background piece of this template, we're looking for you to provide information on relevant factors that are maybe impacting your therapy session. And under assessment, we want to see your clinical statement of the situation, how the patient is progressing towards goals, what is your clinical reasoning on how to move the patient forward, what are your skilled interventions you're providing. And under recommendation, it's about the action steps you're going to take to move that patient along in their therapy plan of care. So like many of you probably, I learned the SOAP note initially in school, and then I carry that through in my work experience. And I really think that the SOAP note was helpful for me to build my critical thinking so I could reason how I'm going to help my patient and provide great therapy services. However, now, much like you are, we're really charged with the responsibility of answering those questions that we talked about earlier, which is really to communicate the skilled need of us to help that patient achieve their outcomes and overcome their illness and disease.